Prednisone is often used for rheumatoid arthritis, or RA. It is an amazing medication because it is an anti-inflammatory. It helps dial down the pain and inflammation that can cause joint issues, whether it's weakness or swelling, inflammation, or other issues coming with rheumatoid arthritis. And it can even help slow joint damage down. So, why isn't it the only drug people use for rheumatoid arthritis? Because prednisone comes with a lot of side effects. I personally had to take prednisone, and I'm also Dr. Megan, the prednisone pharmacist. And so I know exactly what it feels like to take it and how harmful it can be. It can cause long term side effects such as osteoporosis, weight gain, and diabetes, infections, and heart disease. We want to minimize your likelihood of having a long term or fatal side effect to prednisone. And so, what should we do? Well, treatment of rheumatoid arthritis with prednisone can be accomplished by using the lowest effective dose. This is 20 milligrams. People with rheumatoid arthritis may use 20 milligrams, may even use up to 60 milligrams, but it's more common that people with rheumatoid arthritis are somewhere around 2.5 to 7.5 milligrams per day. And some people take it long term for a very long time. And if it's long term, the goal is to get you on the lowest effective dose of prednisone. That means that we're taking the dose as low as we possibly can while making sure that the joint pain and inflammation is kept at bay. And so often for people, that could be 2.5 milligrams a day or 5 milligrams a day. And some people are on that for years. But there's a lot of controversy about whether or not you should do that. Some doctors think, oh, only give it as bridge therapy. And other doctors are saying, well, it helps pretty much everybody, so let's give it to everybody. And there's a middle ground here where it's safe and effective, and we got to find that balance that's best for you. And I have a whole video going through all of the different things that you can look out for whether or not the benefits are going to outweigh the risks for you. So check that out. But for people who take prednisone for RA, some things you can do is to take care of your health by being on as low a dose as possible, by getting as much exercise as you can do, even while with your condition, whether that's walking or swimming, getting water aerobics, doing what is within your abilities. Just making sure you keep moving, keeping your weight healthy, and supporting your bones to prevent osteoporosis with calcium and vitamin D. Those are some of the things you can do to help prevent long-term damage. What about other medications for rheumatoid arthritis? So I mentioned I'm the prednisone pharmacist, but before that, I helped insurance companies to decide who was best qualified to get a lot of these medications that are alternatives to prednisone. Some of them are relatively inexpensive and others are incredibly expensive. And I got to read hundreds and thousands of people's chart notes so I could understand who fulfilled the insurance company's requirements. It's called an appeal for a prior authorization. And I sneak peek, I tried to give it to whoever I could, but they had to meet the qualifications, and I was kept to a list of things that had to be true for people to get them. And so, what are these other drugs that a doctor might ask your insurance company to pay for? Well, I'm going to cover the cheap ones and old ones first, and then I'll cover the newer, more expensive ones next, okay? So the old ones that have been around since before I was born are called disease-modifying anti-rheumatic drugs. And the acronym is DMARD, D-M-A-R-D. And these drugs are essentially immunomodulators. They change your immune system in some way. And because it's your immune system they're affecting, it can take a long time. And so these drugs include methotrexate, sulfasalazine, hydroxychloroquine, leflunomide, and others. And they can work very well in certain people, but they can also cause pretty terrible side effects in certain people. And so a lot of people who are prescribed prednisone or methotrexate, they're given the choice. They say which one is worse. And most people perceive methotrexate being worse because it was originally a cancer medication. But prednisone is actually worse. The doctors, the rheumatologists said, prednisone is a more harmful medication than methotrexate. It's like a fly and a honeybee. Prednisone is the honeybee and methotrexate is the fly. You don't want either of them at your picnic, but the fly is just annoying. Like you might get nausea, vomiting, and diarrhea from methotrexate, whereas the honeybee can be incredibly harmful. It can actually kill you, like the side effects: osteoporosis, heart disease, diabetes, infections. Prednisone causes more infections than methotrexate. And so, if you can, avoid prednisone by taking these medications. So, one strategy you might use is prednisone works pretty quickly. For most people, it can work, a lot of people with rheumatoid arthritis, within a half an hour, and maybe an hour, maybe 2 hours, maybe a few days, maybe a few weeks, but it's usually very quickly. Whereas these immunosuppressants, it takes weeks to months, even years for them to work properly. And so in the meantime, you can, like, as the other DMARD works, you slowly are getting benefit from it. Prednisone's working instantly. And so you can have them meet in the middle over time, so that once this other drug is finally working, then you can slowly get off prednisone. That's called tapering it off, getting into the lowest effective dose for you. So those are the old-fashioned DMARD drugs that are the classics that work. They just cause side effects and take a long time to get there. Then there's newer and incredibly expensive medications like Humira, which is adalimumab, and Enbrel, which is etanercept, and many others. And these medications work by affecting different parts of the immune system, whether it's interleukins or other inflammatory markers, and they are much more targeted. They are monoclonal antibodies, and so they mimic the antibodies that are in your body, so your body doesn't immediately destroy them. And they get in and they help your immune system to stop attacking itself with your autoimmune rheumatoid arthritis condition. So some of these are complete miracles and complete game changers for certain people. And for other people, they don't even work at all. And they're $15,000 a month, and you're going through all this and having all these side effects, and it's not even doing anything. And it's really hard to find the right one. And then if you find the right one, sometimes you can have auto antibodies, so that your immune system realizes that you're giving yourself a treatment, and you create auto antibodies to that. And so then it stops working well. And so it's not easy to find the right treatment for rheumatoid arthritis. But we can find ways to make the benefits of treatment outweigh the risks. And that's by doing things that help make prednisone work better for you, to avoid the side effects of prednisone by counteracting them. And so I have a list of what you can do to prevent and counteract prednisone side effects in my prednisone checklist. You can download it by clicking the link below. And not only does it have that list, but it also has the top 7 things that people make as a mistake. The top 7 mistakes people make while on prednisone. And I don't want you to make those mistakes. And so if you download this PDF, it's a free printable, then all you have to do is print it out, read it, and implement it. And you will know exactly how to counteract prednisone side effects and how to avoid the top 7 mistakes people on prednisone often make. Just click the link below to download it now. Signing off as Dr. Megan, your prednisone pharmacist.